Assalamualaikum students. So today we will discuss the questions regarding the pectoral region. So we will discuss the SCQ questions regarding the pectoral region. The question can come in the form of give in tabulated form the origin, insertion, nerve supply and actions of muscles of pectoral region. Or in other words, they can ask give in tabulated form the origin, insertion, nerve supply and actions of muscles connecting the upper limb with the thoracic cage. Now these are four muscles which are present in the pectoral region or connecting the upper limb with the thoracic cage. These are pectoralis major, pectoralis minor, subclavius and serratus anterior. Here in the picture you can well observe the four muscles. The pec major, which is a large muscle. Pec major is a large muscle present in the pectoral region. This has got two heads, the clavicular head and the sternocostal head. Then the pectoralis minor, this is present beneath the pectoralis major, and you can see here that it is arising from the coracoid process inserting into the ribs. And then we have the serratus anterior with serrated margins, you can well observe. Now the fourth one is the subclavius muscle, which is a small muscle which is present beneath the clavicle. So we will discuss one by one the origin, insertion, nerve supply and actions of the muscles. So first of all, the pectoralis major muscle. So this has got two heads, the clavicular head and the sternocostal head. So clavicular head arises from medial half of the front of the clavicle. So you can see medial half of the front of clavicle, and then the sternocostal head from the sternum and the upper 6 costal cartilages, and aponeurosis of the external oblique muscle. So this external oblique muscle is an abdominal muscle from which the sternocostal head, it's from its aponeurosis the sternocostal head also rises. Then we have the insertion. So insertion of the pectoralis major is lateral lip of the bicipital groove of the humerus. So nerve supply is from medial and lateral pectoral nerves, and actions regarding the actions, the sternocostal head do the adduction of the arm, medial rotation and medial rotation of the arm, adduction and medial rotation of the arm, while the clavicular head also it flexes the shoulder. So this muscle also helps in climbing. So in the coming slide we will see another question regarding the give the origin, insertion, nerve supply and actions of muscles of climbing. So now the pectoralis major, it is located deep to the pectoralis minor, it is located deep to the pectoralis major. Origin is from 3rd, 4th, 5th ribs close to their costal cartilages. Origin is from 3rd, 4th and 5th rib close to their costal cartilage. Insertion is into the coracoid process. Nerve supply, medial pectoral nerve, and what does it do? It causes depression of the shoulder. So this is the main muscle which is causing the depression of the shoulder. And number 2, it draws the ribs upwards and outwards during inspiration. Draw the ribs upwards and outwards during deep inspiration. Muscle of this table is the serratus anterior. So serratus anterior arises from 8 digitations from upper 8 ribs. You can see the 8 digitations arising from the upper 8 ribs. These are the 8 digitations which are arising from the upper 8 ribs. Now insertion is the anterior aspect of the medial border and inferior angle of the scapula. So this muscle is inserted into the medial border of the scapula from superior angle to inferior angle. Nerve supply is by long thoracic nerve. This nerve arises from roots of the brachial plexus, that is the C5, C6, C7 roots of the brachial plexus. This is also known as the nerve of serratus anterior or the long thoracic nerve. Now action of the serratus anterior muscle, it draws the scapula forward, as in boxing, draws the scapula forward. So it is also known as boxer muscle. So when a question comes that give the origin, insertion, nerve supply and action of a boxer muscle, so you can write the origin, insertion, nerve supply and action of serratus anterior. So it also rotates scapula outward in raising the arm above 90 degrees. So it does abduction above 90 degree with the trapezius muscle. Question from this region: what is clavipectoral fascia? Give the structures piercing this fascia, or they can ask about the attachments also. So clavipectoral fascia is a dense fascia, thickened membrane of deep fascia between the subclavius above you can see here subclavius above and the pectoralis minor below. So it covers the pectoralis minor also, and then it is attached in the armpit to the axillary fascia. Now it is pierced by certain structures. So we use a mnemonic known as the caul. So C in the caul is for cephalic vein, A is thoracoacromial artery, then double L, lateral pectoral nerve and lymph vessels, few lymph vessels. So this pectoral fascia, this clavipectoral fascia is pierced by four structures, that is the cephalic vein, thoracoacromial artery, lateral pectoral nerve and some lymph vessels. So you can use the mnemonic for this, that is the caul. So another question can come about the winging of scapula, that is a 30-year-old laborer carried piles of bricks on his both shoulders to 4th floor at a construction site. 2 days later, he was unable to do any pushing and punching movement on the right side. On examination, the inferior angle and medial border of his right scapula was excessively prominent. So the question can be asked in this scenario is, what is the diagnosis, or what is the condition called, which nerve is typically involved, and how might it affect patient's ability to perform daily activities. So in this picture you can well observe the prominence of the medial border of scapula when the patient is asked to perform pushing movements. So this is the medial border of the scapula. This is unusually prominent when the patient is asked to perform the pushing movements. Winging of scapula. One of the actions of serratus anterior is to hold the scapula against the rib cage. If the long thoracic nerve is damaged and the serratus anterior therefore paralyzed, a specific clinical sign is produced. In such case, the scapula is no longer held against the rib cage and protrudes out of the back. So it is said to have a winged appearance. Long thoracic nerve palsy is thought to be most commonly occur from the traction injuries where the upper limb is stretched violently, gunshot injuries or stab wound injuries in the axilla, any surgery in the axillary region, for example in case of breast cancer surgery for the removal of axillary lymph nodes. Summarize the questions. Number 1 is give the origin, insertion, nerve supply and actions of muscles of pectoral region or the muscles connecting the thoracic wall with the upper limb. What is clavipectoral fascia? Give its attachments. Name the structures piercing this fascia. Third question is, a 30-year-old laborer carried piles of bricks on his both shoulders to the 4th floor at a construction site. 2 days later, he was unable to do any pushing and punching movements on the right side. On examination, Inferior angle and medial border of his right scapula was excessively prominent. Name this condition. Which nerve is damaged in this case? Give the origin, insertion, nerve supply and action of muscles paralyzed in this case. So the serratus anterior muscle can be asked in various forms, the question regarding this muscle. So another question can be give the origin, insertion, nerve supply and action of the boxer muscle. So this is also the serratus anterior muscle which performs pushing and punching movements. Now the last question, give the origin, insertion, nerve supply and actions of climbing muscles. So as we have gone through the pectoralis major muscle, so I have told you in that muscle that it also helps in climbing. So the other muscle which helps in climbing, which perform the climbing action, is the latissimus dorsi, which we will do in another video. So the climbing muscles are the two muscles, that is the pectoralis major and latissimus dorsi. So thank you. Hopefully you are able to grasp the concepts regarding the pectoral region by this video.